Welcome to my podcast, Living Well with Robin Stoloff. So glad you're with me today. When knee or hip pain affects everyday activities, replacement could help you get back to your life. And now this procedure can actually be done as same-day surgery. It's amazing. Here to explain robotic knee and hip surgery is Dr. Fabio Orozco of Orozco Orthopaedics in Manahawkin and Linwood, New Jersey. Thank you so much for joining us. So this is
Thank you, Robin.
It's amazing now, especially with COVID. People don't want to spend a lot of time in the hospital. Explain how this all works.
Thank you, Robin. I appreciate having me in your show. It's always a pleasure to be able to talk to you. Yes, Robin, COVID have really changed the world, and the medical world is actually different because of COVID. I do tell you that in the hospital we have done tremendous work to make sure that things are very safe for patients. We use all the proper measurements, protective equipment, testing, etc., that make patients stay in the hospital very safe. But I tell you, a lot of patients are still hesitant to go to hospitals and especially stay there for a long time, even though, again, we have done a tremendous job making the hospital very safe. And, that's one of the reasons why surgical centers become very important in our new world. A surgical center can offer basically the same level of care than a hospital, is very cost effective, is very oriented towards customer service and safety, and we have an opportunity today to do hip and knee replacements in a surgery center. So not every case has to be done in the hospital anymore.
And we have a brand new surgery center in Egg Harbor Township that's absolutely beautiful. I saw it, state-of-the-art equipment. Tell us a little bit about robotic hip and knee replacement surgery.
Yes, Robin. So I do all my hip and knee replacements with robotic assisted surgery. Robotics brings precision to already very good surgery. So it is amazing to see the amount of precision that it brings for hips and for knee replacements. You can put numbers on what you're doing. It has a very good prediction of how the surgery is going to go. So the preoperative plan is something that can be done very well with a lot of digital technology, and then we can apply that to a hip or a knee replacement. Is one of the tools that we use and one of the latest technology, that we have. But it's not the only thing. I think that in order to be able to have a hip or a knee replacement done properly in a surgical center, there's many other things that are just as important as using robotics. For instance, not cutting the muscles, not cutting the tendons, working on a multimodal approach to pain control, not using IV narcotics, using a lot of blocks that the anesthesia department is excellent doing, really helps to promote patients' rapid recovery. Also, working on patient expectations is extremely important, and a good family support, it also helps to be able to send patients home the same day.
That is a really good point, because you do have to manage expectations. It's hard to say, I know, but how long is a general recovery time for a patient after, say, a knee replacement surgery, and how involved do they need to be in that recovery?
So that's, again, an excellent question. Recovery is different for everybody. But I tell you, without cutting the muscles, without cutting the tendon, using these new equipment that we use on robotics, recovery times are very fast. And those days of people recovering from a hip or a knee in 4 months, 5 months are really gone. And for the most part, people recover in a matter of weeks. With the approaches that we make to the hip and to the knee, people can actively walk the day of surgery. And that starts the whole healing process. So there are many exercises that can be done at home. Physical therapy is not as intense as it used to be. And there are many patients that don't even need a formal physical therapy program in a place, which again again, is important with this COVID era where patients would like to prefer to rehab at home.
Sure, everybody wants to be home. It's much easier. And you are actually doing these surgeries in patients that are younger now. Explain that.
Yes, Robin, we are very active nowadays, and with materials that now last longer. There are many of our patients are in their 40s, in their 50s, and those days of hip and knee replacement only being done on patients in their 70s and 80s are no longer here. Many of our patients are younger, again in their 40s, very active, and with expectations of going back to their life sports, which thanks to God we're able to accomplish with the new materials that we have available for hip and for knee replacement.
They last much longer, so that's why you can do it at a younger age. And my knee's been bothering me for many years. I play a lot of tennis, and you've looked at that before. But if I can avoid surgery, I'd like to do that. But how do you know when you're actually really ready to get surgery?
Yeah, so that's an excellent question. And, I think that the reality is there is a point that for everybody is different, but it's very important to try conservative treatment. For knees, for instance, injections of cortisone, injections of gel, activities modifications, losing weight, anti-inflammatories, similar things for hips, while injections don't work as much and usually are not indicated. But again, losing weight, anti-inflammatories, activities modifications can help. Once conservative treatment is not working, you got to start thinking about getting this fixed. And I think the most important part for everybody is to get surgery done when it's affecting quality of life. And that for everybody is different. And for some people is be able to walk independently. For some people is be able to do certain sports or certain activities. For some people is gardening. But for the most part, basically is affecting quality of life. And when that happens, that's the time to get your hip or your knee fixed.
Yes, and I've had some friends and people that I know who have gotten either hip or knee replacement, and most of the time they say, I wish I had done it sooner because they were in such pain. And then they can perform their functions again normally, and it's just like a new lease on life.
Absolutely.
Yes, it's a great thing to be able to do that. And now with same-day surgery, it's even easier, so you can avoid staying overnight if possible. It's not for everyone, correct? We should say that.
Yes, I agree. I do tell you, most patients nowadays would like to go home as soon as possible. And in our surgical center and in the hospital, we have the opportunity to send you home the same day or the next day after surgery. But many of our patients would really like to just go home the same day. And with proper pain control, working on expectations, and having somebody at home that can be your coach, can be your support, not just physically, but just emotionally, is something that we can do now on a daily basis. Not too long ago, people who had a hip or a knee replaced had to be in the hospital 3 days, had to have catheters and wires and things. Nowadays, people don't have Foley catheters, don't have IVs, don't have extra oxygen, don't need any of those things. We don't put drains, we don't use staples. So the dressing doesn't need to be changed. So it's a very different time. So most people can go home the same day or the next day after surgery, which ultimately is better for them, not just physically, but also mentally. It's very important to go back to your regular life and be in your regular environment.
Absolutely. And I know you have a great team, and you yourself will help a patient before surgery and explain to them exactly what to expect and try to ease some of their fears.
Absolutely, yeah, and that's very important. Expectations, working on questions, any fears that they have. The more you know about what to expect, the better prepared you're going to be, and that's why it's very important to have a multimodal team approach. Every discipline can help us help the patient to recover better. My nurse, my PA are a big part of my patient's care, and without them, doing things like these, like same-day surgery, will not be possible.
Well, it's great to know you have a wonderful team there and that this surgery has progressed to the point where it is actually now a same-day procedure. That's many people listening to that are probably surprised to hear it, but it is true, and it's great that they can do that. So if people have some questions or would like to get in touch with you, what is your website?
So our website is orozcoortho.com. And our phone number is 609-300-7779.
Dr. Fabio Orozco of Orozco Orthopaedics with 2 locations, Manahawkin and Linwood. Thank you so much for joining us and shedding a light on this very interesting procedure, same-day hip and knee replacement surgery. Appreciate it.
Thank you, Robin.
And we'll have a link to Orozco Orthopaedics in the notes. Thank you all for joining us today for another edition of Living Well with Robin Stoloff, empowering you to live a healthier life. We're here to help you learn more and live better. Sign up to get notifications on our new weekly episodes. Until next time, please stay safe and keep living well.